Hello, and welcome to The Excerpt. I'm Dana Taylor. In the wake of the Supreme Court's overturning of Roe v. Wade in 2022, 19 states passed either full abortion bans or restricted their use. Two new studies published in JAMA this month have found increased infant mortality along with births in most states with abortion bans. What's behind this alarming trend, and who is being impacted most? Adding here that this research was funded by NIH grants, money that is now at risk because of recent executive orders. I'm now joined by Suzanne Bell, one of the authors who studies fertility and related behaviors at Johns Hopkins University. Suzanne, thanks for joining me on The Excerpt.
Yeah, thanks for having me, Dana. Thank you for your interest in this work.
You worked on both of these new studies, which were a collaboration with researchers at the University of California. First, can you describe what data was included in these studies?
So we used birth certificate, death certificate, and census data from 2012 through 2023 for all 50 states and the District of Columbia.
And so what does this latest research tell us?
We used these comprehensive vital statistics data to examine the impact of abortion bans on fertility as well as infant mortality. And we used this Bayesian panel data model to estimate how these restrictions affected these outcomes in states with a complete or 6-week abortion bans, which included 14 states. And this approach allowed us to estimate what the fertility rate and infant mortality rate would have looked like if these restrictions had not been in place, and compare that to what we actually observed. And overall, what we find in these two companion papers is really strong and compelling evidence that fertility and infant mortality rates in states with abortion bans were higher than would have been expected in the absence of these policies. Specifically, we estimate there was one additional birth above expectation per 1,000 reproductive age females in states following the adoption of abortion bans, or a 1.7% increase in the fertility rate. And this is equivalent to more than 22,000 additional births by the end of 2023. This study suggests that approximately 10% of abortions that we might have expected to have occurred in these states during this exposure period instead resulted in a live birth. And I want to highlight some state-specific findings with regard to this study in particular. If we exclude Texas, which imposed an abortion ban nearly a year earlier, there were 6,000 additional births above expectation across the other 13 states with bans. And this is equivalent to an 8% increase. So 73% of these additional births that we estimated occurred as a result of these bans actually occurred in Texas specifically. And regarding infant death, or the death of a child in the first year of life, we found a 6% increase in the infant mortality rate in states that banned abortion, above what we would have expected without such bans. And this corresponds to an estimated 478 excess infant deaths. And 80% of these excess deaths occurred in Texas.
Suzanne, with regards to higher cases of infant mortality, the research points to a couple of different dynamics at play. What are they?
Our studies provide the broadest evidence to date of specifically the unequal impacts of abortion bans. So for our fertility analysis, we estimated that impacts of these bans were largest among racially minoritized individuals, specifically Black and Hispanic people, those without a college degree, people with low income who qualify for Medicaid, unmarried individuals and younger individuals, as well as those residing in southern states. And these patterns and subgroup changes were largely consistent across states. And then in relation to our infant mortality findings, we saw a really large difference in the impact of abortion bans on Black infants in particular. Among states with bans, Black infants died at a rate 11% higher than would have been expected in the absence of abortion bans, compared to a 5% increase above expectation among white infants. And similar to our fertility findings, we found that there were larger increases in infant mortality in southern versus non-southern states. We also looked at causes of death in the infant mortality analysis and estimated that increases were also higher for deaths that were due to congenital malformations as well as non-congenital malformations, but a larger relative increase among those with these congenital malformations, which are often doomed pregnancies, conditions that are not compatible with life. And we saw an 11% increase in the rate of infant mortality due to these causes of death, compared to a 4% relative increase among all other causes of death. And I think these results really indicate that legal exceptions based on fetal anomalies are not going to fully offset the negative effects of abortion bans on infant health.
Were you surprised by these results?
Given the incredible efforts of groups and providers supporting access to abortion, which has enabled thousands of people to travel out of state for care or connect to online vendors and providers offering telehealth under SHIELD laws, We weren't exactly sure whether we would see any impacts of these abortion bans on the number of live births or subsequent pregnancy outcomes, particularly something as rare as infant mortality. So the fact that we estimated these significant impacts at all was somewhat surprising in a way, but also surprising and deeply saddening was the statistic I just mentioned earlier, was the more than twofold larger increase in infant mortality among Black infants compared to white infants. We had done earlier work on related topics in Texas following the imposition of their 6-week ban that was imposed in September of 2021, so nearly a year prior to the Dobbs decision, and had shown increases in fertility and infant mortality in those studies. But we weren't certain these impacts would be replicated in other states. And part of that is because Texas is unique in many regards. And I highlight some of the ways in which Texas has an outsized impact on our overall findings earlier. Texas is a really large state, and people have to travel large distances to receive care out of state. And additionally, among the states with bans that we examined, Texas had the largest number of abortions provided in state prior to the bans compared to the other states that imposed bans. And that was more than 58,000 in 2022. So the potential for impact was really huge in Texas. And we weren't sure whether we would see similar impacts in other states as well.
So I did want to ask about that. Did your findings reveal any disparities between the different states you studied? And if so, how do you explain that?
I think the largest state specific finding that we see is just the general Southern versus non-Southern state differences in impacts. Generally, in both the fertility and infant mortality analysis, we see much larger impacts in Southern states, and specifically Texas, as well as Kentucky, jumps out as a state that had consistent and large impacts across these two studies. And thinking about context also, it's important to think about the fact that even prior to these abortion bans and restrictions imposed following the Dobbs decision, states that are hostile to abortion already had much worse maternal and infant health outcomes, with many counties in these states considered maternity care deserts, particularly in the South. And so our findings suggest these disparities across states actually worsen when restrictions are imposed on reproductive autonomy. And it's important to contextualize these additional bursts in the rich body of research from the Turnaway study and other studies that show how not being able to obtain an abortion has negative physical, mental, and economic implications for birthing persons, their children, and their families, and can undermine achieving health equity. And so we're going to see this disproportionate burden on these states, particularly in the South, where even just thinking visually about the map of states that have abortion ban, that's where you see the most contiguous impact of bans. And so we might have expected that that's where we'd see the largest burden. Also, the additional births and infant deaths resulting from these abortion bans occurred in states with among the weakest social services and worst health outcomes, as I alluded to, potentially deepening existing disparities and placing additional burdens on already strained resources.
Infant deaths had been declining in recent decades. How do recent numbers compare with those trends, and what drove that decline? Better medicine, better access?
Yeah, there's been a sustained effort to try to improve infant health outcomes and reduce infant mortality for many decades. And I think that's a real success story in public health and population health in the US in recent years. And so this is showing a potential stall or even reversal of that progress that has been made through interventions at the population and clinical level. And so I think that is obviously really troubling and perhaps a bellwether indicator of other population health impacts that we might expect to see. I think that policymakers need to think about the downstream repercussions of these policies on maternal and infant health outcomes and the potential for it to worsen disparities like we see in relation to the racial and ethnic differences in our infant mortality impacts, as well as disparities across states that already existed even prior to these bans and the potential for worsening outcomes moving forward.
What can the rise in infant deaths tell us about overall health outcomes?
Infant health is really a bellwether or harbinger of future population health. That's the next generation. And if we're seeing these striking shifts in this really essential indicator of infant health, infant mortality, I think that is boding poorly for future population health, particularly in these states that have imposed these abortion bans. And we really think that infant mortality is just the tip of the iceberg there's undoubtedly many more individuals, infants and their families, that were impacted by conditions, severe conditions that need continued support and treatment, that are struggling in the aftermath of this experience, but whom are still alive and trying to support this struggling infant. And so I think that there's essential resources and support that are needed for these families that are perhaps still suffering, and that includes the people who have experienced an infant loss.
And finally, did the study suggest any prescriptive solutions that were apolitical on the issue of abortion access?
I think this definitely signals the need for quality obstetric and pediatric care, and potentially increased need or likelihood of pregnancies coming to term with fatal fetal diagnoses or other complications. So ensuring that that care is available to people regardless of their zip code or where they're residing. And unfortunately, this is happening in a context of continued obstetric and hospital closures, particularly in rural areas. And so I think there's a way in this in which what we're finding in regards to the impacts of these abortion bans might be interacting with some of these existing trends, and potentially worsening access to and receipt of quality obstetric care for pregnant individuals. I do think these findings, I need to say, indicate that many people who were pregnant were unable to overcome barriers to access to abortion services, and instead were forced to continue unwanted or unsafe pregnancies to term, including doomed pregnancies diagnosed with fatal anomalies, that in the absence of these bans, termination would have been an option for them. So that's kind of the mechanism that we see linking these bans to the outcomes we observed. And importantly, as I've mentioned, we find these effects are not uniformly felt, with the largest estimated impacts on fertility among populations experiencing the greatest structural disadvantages, and in states that already had among the worst maternal and child health outcomes. And ultimately, these bans harm people and families, with our studies providing the most comprehensive evidence to date on the unequal impact of these policies on fertility and infant mortality specifically. Repealing these abortion bans and allowing pregnant people and their families to decide the right course of action in consultation with their doctor and genetic counselors where necessary is the most obvious way to reduce the population health impacts of these bans. Many legislators and groups are also trying to include additional fetal anomalies in the list of exceptions allowed under these bans, which I think can help as well. However, our infant mortality findings indicate that even infant death due to non-congenital malformations increased as a result of recent bans, suggesting that legal exceptions based solely on fetal anomalies will not fully offset these negative effects of abortion bans that we observed on infant health. Also, pregnancy is just inherently a risky and nuanced condition, and no list of exceptions could ever fully encompass every situation and the risk a potential patient or pregnant person might face.
Thank you so much for sharing insights on your work on this very important issue, Suzanne.
Thank you so much, Dana. Really appreciate you having me on.
Thanks for watching. I'm Dana Taylor. I'll see you next time.